Yes, 6:24 now. The coronavirus outbreak has been described as almost certainly the biggest crisis the NHS has ever seen.
So how are GPs coping at the moment? Faye Kirkland is a journalist and a working family doctor. She's been given special access to a surgery in London to see how those on the front line are dealing with a massive surge in demand.
A young patient needing to be seen in the isolation room.
Hello. Hi, I'm Dr. Wheatley.
A fever and a runny nose. What's on everyone's minds? Could it be the coronavirus?
Well, I'll tell you what, I'm going to start by checking her temperature first.
Reassured it's likely to be a common cold, but COVID-19 can't be ruled out.
There's more and more cases every day, but no one we know has had it, so I'm hoping she won't have it. It's just more worried about passing it on to sort of elderly people or more vulnerable people.
All right, she hasn't got any other symptoms.
Receptionists call ahead of patients' appointments to check they don't have symptoms of the coronavirus. If doctors can treat people over the phone, they will.
And
It's been a busy morning for this GP, returning an increasing number of calls to patients, including someone working for the NHS.
You're at risk because you're a healthcare worker. Have you been in contact with any patients that have been symptomatic or have been diagnosed with COVID-19?
How worried are you about the health of the GPs here, the staff here, and what impact that might have on the whole of the GP workforce?
I don't want to get sick, but I still want to be able to do my job. And if I'm sick, then, or even exposed and have to self-isolate, then that leaves our surgery without a doctor, which, you know, puts extra strain on colleagues, and you don't want to do that. But I don't want to infect elderly and vulnerable people. I don't want to infect my colleagues. I don't want to infect my family.
To protect herself, she needs the right equipment from the NHS. It arrived at the surgery just 2 days ago.
Massive impact on...
We took these concerns to the chair of the Royal College of GPs and asked, had enough been done to protect staff?
Not yet, I think, is the answer. No, I think we need to be a little bit understanding of the pressures that the whole system is under. This is a massive crisis, probably the biggest crisis that the NHS has ever had to face. You know, we're not saying that health professionals are more important than patients. We're just saying that health professionals have a responsibility. We therefore need to keep them as healthy as possible, and we need to get them back into the workforce as quickly as possible. So we are asking that health professionals are tested early.
The government will do all we can to help you and your family during this period.
The Prime Minister has asked patients with mild symptoms not to call the NHS 111 helpline.
The patients with milder symptoms are going to be very, very anxious, and their only access point to the NHS, if it's not 111, is primary care and their GP practices.
Busy days ahead for doctors in the fight against the coronavirus. Faye Kirkland, BBC News.